think we are on. Wait a second, see if we can't make sure anyone joining us can find us. My lovely video assistant, also known as Jennifer Gifford, trying to figure it out in the background. Ready? All right, so just to introduce myself, I'm Dr. Eric Gifford. I am basically the sports medicine physician, and we founded 417 Sports Medicine Orthopedics, and I am a fellowship trained primary care sports medicine physician. So that means I did a family medicine residency, and then I followed that up with a sports and orthopedics fellowship. I did my undergrad training in Texas, and then I actually went to the Caribbean to medical school, and came back to University of Tennessee for my residency and fellowship, which was at the Campbell Clinic Orthopedic Group in Memphis, Tennessee. And since then, I came over and I joined Cox Health in their sports medicine department. I was there for just over 6 years, and honed a lot of my skills and learned a lot, but also during that time I wanted to do a little bit more, and so now here we are with our own practice and a lot more opportunities to do more with regenerative medicine and rehabilitation, performance, just a lot of things that we couldn't really do working for the hospital institution, but now we have the freedom to do so. I have been a sports med provider for everyone from Division I football with the University of Memphis, all the way down to the high school level, multiple high schools. In fellowship, we also covered a Division II university, Christian Brothers University, and also a Division III university, which was Rhodes College. So I've kind of dealt with all levels of athletes. And then we also see a ton of osteoarthritis, and an aging population that I'm now a part of. I'm now 40 and I feel it. But we take care of people with joint pain, and we take care of young kids with broken arms and fingers and legs. So it's not just sports medicine. We do a lot of just non-operative orthopedics. The clinic that we have here, it's on the location-wise, it's just south of Springfield. It's still in Springfield city limits, but it's on Campbell and Plainview Road, which is also known as Farm Road 182. We're in the Plainview Corner Shopping Center, and right next to Healing Paws Veterinary Clinic, and right next to Marco's Pizza. So if you're hungry, you can get a pizza. If you had a dog that needs to be neutered, we can go right next door. But essentially, we wanted to make this video just to tell everyone a little bit about us and what we're doing, and the procedures and things that we still will be able to do here, and just give you a little bit of a history and lowdown of who I am and what we're going to do with this practice. I've even got notes that I didn't type out, somebody else did. So again, I kind of talked about what we do. I do non-operative orthopedics and sports medicine. We opened up a walk-in clinic. When I came to Cox Health in 2014, we had started a sports med walk-in, which was primarily just for athletes. We were trying to see our high school athletes that we took care of about 15 to 18 area high schools, and so we were trying to have a clinic for those athletes to come into. Well, that grew and expanded, and we were like, we should just open this up to all orthopedic or musculoskeletal injuries, and so we did, and we were very busy there. And as part of what I like to do is see acute musculoskeletal injuries, and so now we have basically the same thing. See if I can see this. So an orthopedic walk-in clinic. We're taking care of anything. It doesn't have to be sport related. It can be somebody that drop something on their finger. It can be somebody that slipped and fell just at home. It has nothing to do with sports. But ultimately, that's part of what I'm operating here is just an orthopedic walk-in clinic. You don't have to have an appointment. Obviously, it's nice sometimes if you call and schedule, but we're happy to see you just walking in. We're not super busy yet, so there's not going to be a really long wait. If there is going to be a wait because we have some scheduled patients before you, we will let you know, and we have a system set up where we can let you leave and tell you to come back at such and such a time when you can be seen specifically. That does away with the sitting in the lobby for 6 hours in a walk-in clinic. Nobody likes that. So there's your walk-in practice. Other than that, we still see a lot of patients that I've brought with me from Cox Health. These are patients that come in on a regular basis to get a knee injected or a hip injected or a shoulder, to get some of that pain relief. And I do a lot of non-operative management, and whether that's somebody that's just not a surgical candidate because they need their knee replaced, but they need to lose some weight first, or they've aged out, they're just not a good candidate due to age or other comorbidities, or sometimes you're too young. We don't want to do a knee replacement on a 30-year-old or 40-year-old. We want to try to get you a little bit further in life before we have to do something major like that. And so I do a lot of inter-articular injections, whether that be with corticosteroid, whether that be with sorry, I drew a blank. Hyaluronic acid in the knees. We do a lot of regenerative, not medications, but a lot of regenerative treatments. That includes platelet-rich plasma. We're branching out into some placental growth factors that we can inject to create that regenerative type healing process. And we're doing that in basically any joint in the body, and also in chronic tendons, or chronic tendinopathies, I should say. So plantar fasciitis, rotator cuff tendonitis, tennis elbow, golfer's elbow, Achilles tendinopathy. There's a lot of things that we can inject with regenerative type treatments to get you significant pain improvement and get you back able to play and or participate or just walk and stand throughout the day. We also are fully equipped with DME, so that's durable medical equipment. So anything that we need to do to offload a joint or keep something in better alignment, we have in stock here, and so we're going to be able to fulfill that need as well. I actually have I enjoy managing fractures, casting, and this kind of stuff, and occasionally if something needs a manipulation that we can do without anesthesia. Obviously some things need to go to the hospital or go see a trauma surgeon, but for simple fractures and simple manipulations, we can numb locally and try to get things in better position and alignment. So that's another thing that we do a lot of is fracture management. Something that we do that's not necessarily musculoskeletal related, but I also am very well versed in concussion management. Obviously that's something that's been big in the last 10 to 15 years, and I like to think of myself as an expert in that field, as we manage a lot of concussions in our high school and college athletes. So that's something else that we are set up to do. We have a lot of testing and some rehab things that we offer to try to get you to recover quicker and guide you through that process. I mean, a lot of times it's just people have questions. They don't understand what the concussion is and what they can and can't do, and we're happy to manage that. We also do some procedures with nerve ablation. I was using radio frequency ablation, and we now have, I would still like to do that. I'm trying to get set up with some of the outpatient centers where we could do that, but we're also doing in-clinic Iovera treatments, and what that consists of is actually cryo. There we go. So basically this little device right here holds a nitrous oxide cartridge, and it is able to emit a very cold, transmit that freezing cold into a needle tip, which then will ablate or freeze a nerve. So we're doing that in clinic. We're working with some local surgeons on their perioperative pain control. So surgeons that they know they're going to be doing a knee replacement, and we can numb the nerves around the cutaneous incision and allow them to rehab quicker, get out of the hospital faster, and also use less narcotics, which is a big push. Everyone's trying to get well, not necessarily get rid of, but use less narcotics to create less addiction and less problems. So that's something else that we have in office, in addition to hopefully being able to do some more geniculate nerve ablations of the knee for chronic pain control. And also we're working on getting into the shoulder with the suprascapular nerve. So there's a lot of opportunities that we're going to be trying to expand on. Say one other thing that we also have here would be your COVID-19 antibody test. So if you really want to know if you had it or you didn't necessarily test, but you think you were pretty sick for a while, we're happy to test you for that. Some people want the antibody test to know if they're safe to travel or what they can do. But let's see. Let's see. My wife put out another section she wanted me to talk about, which basically, what do we cover? I think I've already touched on most of this, but literally head to toe. We'll see people for neck, shoulder, elbow, wrist, hand, finger, low back, hip, knee, ankle, foot, anything musculoskeletal related. We are happy to see. I have just a ton of experience in managing most of those conditions, and if I don't feel like I can do something to make you better, I usually know where to send you, meaning I'm happy to kind of guide you in that direction. If I don't think I can help you, we will definitely send you to the right specialist in that area. And that's the same thing holds true with, we obviously have a non-operative focus in our practice. I'm not a surgeon, but if something does need surgery, we are happy to refer you on to one of our surgeons, whether it's at Cox or whether it's at Mercy or anyone that's independent. Again, if we're not making progress or something is surgically indicated, we're happy to make that happen. We also we have in-house x-rays, so we do a lot of our imaging here. I do a lot of diagnostic ultrasound in clinic, not only for guidance in injections, but also for diagnosis. Today I was able to visualize a big hematoma and was able to see that there was free fluid in it, and then we aspirated it and made the guy's leg feel significantly better. We used it just the other day to look at a complete Achilles rupture. There's lots of things you can use an ultrasound for that, sometimes that's way cheaper than an MRI. Sometimes the MRI is still necessary, but that's another thing. We can refer you and make that appointment, get you set up for advanced imaging options, whether that be MRI, CT, anything. We utilize MRI of Springfield. We can also refer to Cox or Mercy. Obviously theirs is a little more expensive, but sometimes that's where the insurance may take you. Let's see. I wanted to touch base on, we're going to have several videos. We're going to do this weekly, but I wanted to touch base on something that we are trying to push, and that's going back to the regenerative medicine. At Cox, we had platelet-rich plasma. It was overpriced, to be honest, and it was difficult to convince patients to do that on a routine basis just because of the price, and it was just inhibitive because it cost so much. Well, I wanted, one, to have an entry-level regenerative type practice, which would be like your platelet-rich plasma. We're going to have other offerings. We'll probably, I'm not into it yet, but we will probably be doing bone marrow aspiration, probably adipose harvesting. This is ways we can get hematopoietic stem cells and mesenchymal stem cells from your adipose tissue. We're also looking at things like Wharton's jelly, which is from the umbilical cord. It actually is very rich in growth factors, and we already do have a program in place for a product called Fluid Flow, which is actually placental derived growth factors, and they take donated placental tissue at the time of a C-section from a willing mother that signed up for this process. This isn't just stealing random tissue. This is a mom that signed up to donate her placental tissue to basically the company where they can extract those growth factors and create some of these healing formulas. It's been used for years in wound care. where the people with skin grafts or large traumatic lesions have been able to get much better, quicker skin recovery by using some of these regenerative techniques, and now they're allowing us to utilize that in the joint or chronic tendon type arenas. And that's going to open up a lot of doors for regenerative practices. It's not invasive. We don't have to tap into your bone marrow. We don't have to tap into adipose tissue or basically liposuction. This is strictly just off the shelf. We can mix it up with some saline and inject it directly into joints or tendons or anywhere where we're trying to get a healing response. Something I wanted to clear up on that is there's a lot of regenerative practices around the country. A lot of them are done through offices that may or may not have anything to do with musculoskeletal care, or some of them are done through chiropractic offices. Nothing against chiropractic offices, but ultimately they don't necessarily have the same training, and we like to let you know that, hey, we're an MD. I have very much so specialized in musculoskeletal care, and we're not just some dermatology clinic or a chiropractic clinic or anyone else. We're very much so in the realm of regenerative medicine and musculoskeletal care. And I think there's a lot of misinformation with regards to stem cell treatment or orthobiologics or regenerative medicine. I mean, those are all terms you'll hear. Some of the misinformation is that we can have you do this treatment that may be $3,000 to $5,000 and you'll never have to have surgery, and we're going to regrow new cartilage. Well, that's not necessarily the case, and in most instances you're not going to rejuvenate that knee to the point where you're never going to have surgery or that you're never going to have pain again. A lot of times these are creating just a small healing response which can calm down pain and give you relief for a period of time, but to think that you're going to have a single treatment and never have to have anything else other, no surgery, no other treatments, that's a little bit misleading. There's even clinics that are showing, I watched this just yesterday on the TV show The Doctors. They were showing a before and after MRI of a person that had a regenerative treatment 3 days prior, and they were trying to prove that it had already filled in her cartilage defect. And just based on science, that does not happen. And so there's some misinformation out there with how quick things can heal and expectations. And also a lot of, not necessarily price gouging, but there's people that are pricing this, $3, $5, up to $10,000 for a treatment that may give you 3 to 6 months relief, sometimes longer, but ultimately very misleading in the way that's brought across. And I want to shoot straight with you. I want you to understand what this is going to do. I want you to understand what this is going to cost, how it's going to work, how those tissues and growth factors are going to be affected, and what it can accomplish. And we really want to be upfront and honest with you. We don't want you to think it's going to be a godsend and never have to have another procedure or surgery, and then 6 months later you're hurting again. We want to make sure that you understand how these things work and what they can accomplish. So I'm happy to talk to people about regenerative medicine. Again, it's not right for everyone. It's not the best answer in a lot of different instances. And I want to shoot straight with you. I don't want to try to mislead you. I don't want to try to sell you something that isn't going to work or is going to cost you an arm and a leg. And in the end, you're going to be in the same position within 6 months to a year. So that's just something that I'm pretty passionate about. We want to shoot straight. We want to be honest with you, but we are excited about some of these techniques because they do show significant promise and they do show significant healing, and it can be a great answer depending on the case and depending on your pain. So that's something that we're pretty passionate about and I'm excited about. We're going to go into a lot more detail on those on a subsequent video, but for now, just wanted to throw that out there because that is something that we're really working towards, and I really want to, I just want people to understand what's happening rather than getting duped into something that may or may not be good for them or just a lot of money. Let's see. We did a contest, and the contest was to post something with the Chiefs, share our page, and like our page. The winner was Tabitha Miller. She's a teacher at New Covenant Academy. She taught my daughter, and she's going to get a gift bag from us, and it's also got a $50 gift card to Wingstop. So we appreciate you sharing and trying to get our name out and improve everyone's awareness of us. So yeah, thanks, Ms. Miller. What else? Any questions have popped up? Nobody's asked a single question? Come on. Nobody wants to know, like, how'd you get that gap between your teeth? Nobody? Am I wearing makeup? No. I didn't wear makeup. I did take a paper towel and dab my forehead, though. Does that count? And my head is right in the middle of Patrick Mahomes' midsection. I should have probably moved that to a different area, but nothing? Still no questions? I'm stalling. Nothing.
Tony said that you're still his father's favorite physician.
I'll take that. So thank you, Tony, for bringing your dad in to see me. I appreciated seeing him. Say what else?
Oh, he wants to know where all the Dallas Cowboy stuff is.
The Dallas Cowboy stuff is stuck on a wax paper roll, and it no longer sticks to the wall. So we're going to have to figure out a way to get the Cowboy stuff stuck to the wall again. I say, Leslie, I miss you too. I hope your knees are feeling better. Greg wants a gift card to Wingstop. So, at any rate, we're happy to be here. We're really excited to be here. We're open, and we're growing rapidly. We've seen patient increasing every week. The awareness is coming around. We've been working with some of the other youth organizations and sports teams, and going out and just reaching out to other outside clinics and letting them know we're here. And we're just excited to move forward with this. Again, our website is 417sportsmedicine.com, and our Facebook page, you should know where it is because you should be watching it right now. Our address, again, we're right at the intersection of Plainview and Campbell. You should have our address on Facebook as well. Yep. And our phone number, 417-771-3147. I forget it every other day. I have to look at it. But ultimately, we're happy to have you call in, make an appointment, or you can just walk in. Are we done?
Greg would like to know who else works at your clinic.
Greg. Who else works at our clinic? Well, Kristen. Kristen Hook works at our clinic. She is working as an orthopedic assistant. That's what her official title is. She has a bachelor's degree and is working on getting into PA school. And she's getting a wealth of experience in orthopedics right now because she's working in X-ray. She's helping me do injections. That's great. Greg Gilmore is my clinic manager, and he is a certified athletic trainer and has a lot of experience with rehab and athletic training. And so he is not only doing billing and coding and everything else from the business side, but he's also coming in and helping us do X-rays and helping with injections and casting and everything else in between. So. Say my wife Jen is our marketing manager, so if you see something super cool on Facebook, she did it, probably not me. And trying to think, anybody else we got working for us? Nope. We got lots of people helping us out in various instances, but ultimately that's the employee group. And when you get somebody on the phone, you're either talking to me, my wife, Kristen, or Greg. Depends on when you call. If it's early in the morning, it's probably me or Jen. I gotta stop answering that phone because I keep on I don't know how to schedule people. It's not good when I answer the phone. Any other questions?
Krista says Greg wants everyone to see his employee
spotlight. Greg did have an employee spotlight, and it was pretty stellar. So everyone check out Greg's life story on Facebook. So I think that's it, and we're gonna, like I said, we're gonna do some fun stuff with our Facebook Live stuff. We're going to have some explanations of people's injuries, say in professional sports. We're also going to do some very specific, why is my shoulder hurt? What's going on with my knee? What's going on with my foot and ankle? What can we do to make it better? And also talk at length about some of the procedures and things that we do to try to get that pain to calm down. We'll also talk about rehab and therapy services because that's a major part of our treatment modalities. But either way, we'll do those in the future. Thanks for checking out the video today, and hopefully you were informed of something. And if anyone you know or yourself needs any type of musculoskeletal evaluation, we're here, we're open, we're happy to see you. And thanks for joining us. All right, and bye. I don't know how to push it out. Finish.